Hello, everyone. We will start in a few minutes. We'll just give everyone time to join us today. Okay, welcome to the Health Tourism After COVID-19, The Road Ahead. My name is Romilly Douglas, and I'll be your moderator. I'm pleased to introduce today's speakers, Irving Stackpole and Laszlo Puszko. Irving is the president of Stackpole Associates, a strategy and marketing and research firm founded in 1991. Irving has over 4 decades of healthcare experience and serves as a mentor for the European Institute of Innovation in Health, an EU program to simulate healthcare and entrepreneurship. He edited Medical Tourism Marketing, the first book on the subject, and he's the co-author with Laszlo of the Marketing Handbook in Health Tourism. Laszlo is an economist specializing in tourism and holds a PhD on the environmental impacts of tourism from Budapest University of Economics. He is a certified management consultant and past president of the Association of Tourism Consultants in Hungary. Laszlo is also co-author with Irving of the Marketing Handbook in Health Tourism and is CEO and co-founder of Health Tourism Worldwide. Both Irving and Laszlo have extensive complementary experience in wellness, health, and medical tourism. Before I hand over the mic to Laszlo, I have a few housekeeping items to cover about this presentation. First, we're overwhelmed by the registrations for this event, so we will host another webinar live on Wednesday, June the 3rd at 12 p.m. EDT. We apologize to any of your colleagues who were not able to join in. Please look out for our email messages. Second, today's webinar is being recorded and will be made available via email to all participants after the webinar for further review and sharing. We'd love to hear from you during today's presentation, and we'll be answering questions at the end of the session. If you have a question for our speakers, please feel free to send through the Ask a Question tab at the bottom of your player. And if your question is for a specific speaker, please let me know. If we don't get to your questions during today's webinar, we'll be sure to follow up afterwards. So without any further ado, I'd like to welcome Laszlo. Thank you.
Very good morning, very good afternoon, and very good evening, depending on where you are, all participants. You're very welcome. We appreciate your interest and your time, especially that we are, I believe, all webinared out in the last couple of weeks and months, because we have had so many. So I appreciate that you chose this one as well. With Irving, we decided to host one because health as such has become such a key issue in our lives, and not just for traveling, but also for living, which may sound a little bit ludicrous, but that's what it is because of the COVID-19. And since medical tourism and wellness tourism have been talked about a lot recently, how they are developing such great market opportunities here, we thought this is probably time to look into it, how we believe it really is going to look like. And certainly, since regulations change day by day, travel opportunities change day by day, obviously, we can tell you what at the best knowledge at this minute or in this moment we can share with you. Just a couple of discussion initiating thoughts from my end, because we will start with the looking at how medical tourism or wellness tourism may look like. Just a very quick and very brief reminder or understanding that health tourism is an umbrella term, and it includes medical tourism as well as wellness tourism. We understand that there are countries where you may have a different terminology, but to give common grounds, I thought it's useful to have this mutual understanding of how we look into this business. So I will be covering the wellness tourism side, and Irving will be doing the medical tourism side, and we will be happy to answer your questions. The demand in wellness tourism or in medical tourism also, we can look at it from the perspective of, is it a voluntary option, is it a prescribed option, is it a necessary option? And after the actual situation when we're opening up, we need to see how relaxation, escapism, spirituality, love completion, or self-image may change in our lives. That are we going to look desperately for relaxation? Do we want to escape from being locked down for months and weeks? Have we become more spiritual, or we decide that, you know what, I want to do something to complete my life as soon as humanly and physically possible, since I don't know when I'm going to be locked down again. I will miss that opportunity, so I just want to do that activity or visiting that site, even for wellness purpose, as soon as I can physically just can. Or I decide that after not being visiting the hairdresser for 3 months, this is the time to pay more attention to my self-image and I do something more about it, including a travel activity. So don't forget the prescribed activities after the opening up could stay same or even more accelerated, because people will be kept from traveling for any kind of necessary or urgent medical condition. At the same time, we might have that all these lovely opportunities like thermal facilities will be further locked down, because, or spas, because we don't quite know how to deal with them and manage them and disinfect them. Or in certain countries, they believe that hot water is actually very good because the lovely virus doesn't actually like it too much. In other countries, they say that that's a way higher risk, so we want to close them, keep them closed for months and months and months. Or you might say that I'm interested in taking a retreat because I want to retune myself. And also you might say that I kept from taking treatments for IVF, and I really believe that this is the time to get this done, and I want to have it done from the best place because this is the last opportunity. Prescribed activities will be covered by Irving later, how we believe that's going to be influenced by the age groups and the various healthcare related regulatory activities by governments as well as insurance companies. Can you have a policy if you're above a certain age? But don't forget, on the left hand side of this lovely chart, you can really see some key trigger points that a voluntary activity might be something that you really want to do very quickly. Depending on where you are and what kind of segmentation you are using, you will need to be ready to change that, or you will be able to look into segmentation in a very different way, because price may not be an issue anymore, or not as much, but will be more important to certain people who lost their jobs. So segmentation, you would need to reconsider. You need to look at all the marketing segmentation recommendations of how many options we have for segmentation. Otherwise, you may want to go back to the old normal, and the new normal will be probably so far away from it that you cannot actually provide the necessary answer, even if you have the best spa forever. Talking to spa therapists, and I know that a couple of colleagues are here on this call, having a treatment provided by a therapist with gloves on may be not your perfect idea for a spa treatment. So we need to think of what is going to be realistic, what kind of a nature orientation or treatment orientation will actually come up after the opening. I think any destination planning health-related services would need to look at, or at least should consider, this other process of thinking, because we might find people who are hedonistic and want to do self-gifting of actually gifting themselves with wellness trips, wellness-oriented trips, or people will look for way more healthy options. They need to be able to, as operator or a service designer or a therapist, will be able to, you will need to be able to describe how it is healthy, how many varieties of health we can have, how many layers of health we can have, and how your treatments and services would need to be enhanced and fine-tuned because of the more specific expectations of the healthy options. Don't forget, these people are not health travelers, not health tourists per se, but even a business traveler, even a cultural traveler, even traveler may look for healthier options from gastronomy, room provision, treatments, just on the side, even cultural events they might want to take part in, well-being related cultural traditions and rituals. So invite everyone to reconsider how you are labeling your services, how you're defining your services, and try to locate yourself on this grid where you actually belong. And don't misunderstand this. It's no good or bad location for your service. It's just you have to find the right one. Also, probably we will be looking into something which is a different way of thinking. Lifespan and health span. Even the World Health Organization started to talk about, don't mention how was your life expectancy, more like look into how many years of your life you can live healthily. I think this COVID-19 really highlighted the importance of that, and people will be looking for options and solutions, and not just some easy marketing labels, but content, and really content-based service provision here. This is one of my favorite things, and I know that service providers, developers, owners, even therapists can go nuts when we discuss these questions, because they believe it's just looking at it in a very different way, and that's what I personally like very much. You really have to make a decision what wellness thing you are choosing. Either you can choose the wellness washing, so you now believe that exactly the same services, just because you will call them wellness or wellness improving, will sell, but this is exactly what's been happening, like anything that green. Or you can go on the whole road and you say all of my services will be wellnessified, or look at my services and value propositions, how I can contribute to my guests' wellness in a more complex way, but it's still not de facto a wellness traveler as such, but all of my services are really looked at from that perspective. You might say that, you know what people will need is fun and entertainment, and I combine wellness and entertainment, and that's what welltertainment is. And sorry about the breaking the language, but I think it's a good label here. And yes, we do have already opportunities that you can do yoga with goats, and then you might say that this is not proper yoga because you can't take it seriously. But to certain people, this is the way to enlighten and even your soul, and have some fun at the same time doing some spiritual activity or physical activity. This, you need a lot of creativity to come up with meaningful solutions. I will give you a couple of examples in a minute. Or you want to become a Weminent, which is a wellness eminent, which basically is that you want to focus on one domain of wellness, one component of wellness, and you want to do that perfectly. You want to have guests who are interested in spirituality, and spirituality in a certain way, and then you gear yourself to meeting the demand of such guests. Not something to everyone, but just certain things, but perfectly to a small group of people. I believe we will see a lot of those happening, because people will be very savvy, and they will need to think twice when they travel to any destination. And when you can redefine and you become an eminent of your service provision, you will find your guests. And yes, this is gin and tonic yoga. This is welltertainment. And you can say that this is totally stupid and unnecessary, but to be honest, I would love to have my gin now, not necessarily with yoga at the same time. But this is what people, even men, can find it attractive. Groups can find it attractive, and yes, you can introduce yoga to people who wouldn't have done yoga otherwise. even if those might say, or many people might say that this is total rubbish, and you just, McDonald's-ifying of yoga. Still, this is one way to reach a different clientele group, a different segment, and you still can do the yoga activities properly, but bring in some fun. I really would like to see a lot of these fusion things coming up, because that makes trips different, and your destination or your services can be really different from someone else's. And yes, you can copy if someone else was doing it already, but you can come up with equally exciting things. And this is, to some who don't understand, this is an evidence-based awareness treatment, because the lava, the volcanic heat is heating up the lava from under you, and you have an umbrella, and you have to spend 15, 20, 30 minutes in that fine lava, granules. But it's good for your skin, good for your detoxification, good for your mood. And you might call it wellness, you might call it entertainment, you might call it a show. It doesn't matter how you call it. People can and will react to it, because you can tell them the story that this is natural, this is giving you certain kind of benefits, and this is very local, you can't have it somewhere else. I really invite all of you taking part in this webinar to do sit down and think about opportunities to come up with all these stories which would have evidence, locality, history, and content, which really redefines you and really refers to all the trigger points that guests of the future will have. Also, and kind of summarizing the awareness part of this discussion and passing on to Irving in a minute, I believe most of you have heard of UX, which is user experience, because everybody's talking about it. I would suggest that we need to move on. This is not just a technical service delivery option, not just service design per se. We need to change this to well-being experience design, not just service design, but understanding how any component of that service, of that journey or the guest journey, can contribute to the well-being of the guest. It's a fascinating task when we do that with partners and clients. It's absolutely fascinating to understand how many small items we can incorporate. And in the end of the day, the guest will say this was the best experience. They will not call it wellness or well-being experience, but we know that physically, mentally, psychologically, or socially, they really benefited from that experience. But it's a certain process that we need to perfect, and you would need to think about it at least, but that's the topic of another little webinar. And don't forget that we understand that traveling as such, especially from now onwards, hoping that the airline travel will not be as horrific as the forecasts suggest, but traveling does contribute to your well-being in general. But we, as professionals working in the business, we need to work on that, how that can be more fine-tuned, how that can be perfected. And this is why we are running this webinar as well, to initiate that discussion, start to talk about it, how after maybe a stressful flight, when you spend 4 hours checking in, and then you're surrounded by, on the crew on the plane wearing all the space suits and all the rest of it. So by the time you arrive, you think this is a horrific experience. You really experience something from us, which is really contributing to your well-being. And then you go home, and on the way home, you have exactly the same sort of unpleasantness, but you will have great memories. And often they say that health tourism is luxury. If you ask me, it's more like necessary luxury, especially from time onwards when we are opening up. So I think that these are some really critical issues here in this topic, and I would like to suggest Irving to take on and talk about how the medical components will come in. Irving, floor is yours.
Well, thank you, Laszlo. Will one of you or both of you acknowledge that you can hear me? Okay, great.
Yes.
So, lovely. So, all of what Laszlo just reviewed is, of course, fundamentally about one side of the market, but also about both sides of the market. That is to say, both the healthcare and the higher acuity sides of the market. We review these markets, these segments in the book we wrote together, but also here in this program, it's important that we all at least understand what our perspectives are, and that in these markets for both wellness, health, medical, dental services, there is an array of demand that ranges from very low acuity demand in gin and tonic yoga, I suspect would array on the low end of the market. And then there's very serious needs. There are very serious demands around complex, even life-saving surgical procedures. In these markets overall, the low acuity, high volume types of services array on this side of the market graph, the market range, and the high acuity services are on the low volume, high unit value side of the market array. So this is a general relationship between the demand and the acuity. The demand for low acuity services is high and the unit value is relatively low, and the demand for complex surgeries, cancer treatments, heart valve replacements, this demand is relatively small, yet it has a very high unit value. Going forward, historically and going forward, the factors that are important in the health tourism markets continue to be destination stability. Consumers want to go where they feel comfortable, where the political and economic regime is stable. Economics is important. They want to make sure, consumers want to make sure, and intermediaries that are referring consumers for complex care that can't be provided in the residence location, they want to be sure that they are referring consumers to locations where their local currency, their sovereign currency, will go far. So the purchase power parity is important. Equally important is capacity. If there's no room in the inn for heart surgery or gallbladder surgery or knee replacement surgery, then why send the consumer there? And in the post-COVID period, this issue of capacity is going to be extremely important. We've seen, as we'll review in just a moment, we've seen a complete redirection of national healthcare systems away from elective procedures to availability for COVID-related treatments and procedures. And what that has meant within the healthcare systems is extraordinarily important. We'll talk about that further in a moment. And of course, reputation, brand. The reputation of both the provider and the reputation of the destination are extremely important to consumers. For the consumers seeking treatments, as Laszlo was describing, that is to say, lava-based treatments or treatments that are only available in a specific location, the destination's brand is critical. It's central to how the consumer looks at and considers the brand. Other situations where the services are of a higher acuity, such as medical treatments, the provider destination, the provider brand rather, can be very critical. For example, going to Mayo Clinic. In January, if you knew that Mayo Clinic was in the middle of Rochester, Minnesota, you may not want to go there in the middle of January. But because you seek treatment for a complex medical condition, the destination itself, Rochester, Minnesota, becomes less important than the destination of the brand. The next issue is access, and this is going to be really important as the world emerges from this COVID frozen or hibernation state of affairs. Access from one point to another will become extraordinarily important to determine which health tourism routes open up before others. I was just listening today to a press conference by the European Union on the travel and tourism conventions that they're attempting to forge within the Schengen area, within the EU travel areas. These are evolving situations that we'll need to keep close watch on, and we're trying to provide information on our website and other sources to customers and clients and colleagues alike. And then finally, it's price. Price is quite different from purchase power parity. It comes at the end of the list because, as Laszlo suggested, we believe in the post-COVID period that price will become either less important or significantly more important in consumers' choice of where to go to consume services. It will become less important where pent-up demand, that demand eclipses concerns about price. And that looks like, no, I don't care what it costs, I'm just going to go. Or it just can't wait any longer, I must go. And I'll do anything I need to do reasonably in order to afford that. Price, on the other hand, could become a real obstacle where millions of people are suddenly out of work. And what we saw in the 2008-2009 Great Recession, which seems like very modest in comparison to today's situation, we saw a very significant reduction in healthcare demand as a result of unemployment. So we need to pay attention to which ends of the market we're focused on and how these issues, how this set of issues will play out in those markets. One of the first things that's important, of course, is travel in health tourism. And this is a chart that shows commercial and non-commercial airline activity for 2016 forward. And as you can see, in March of 2020, all travel plummeted dramatically. And we've seen that continue. Here in my adopted hometown of Lisbon, we used to hear jets flying by overhead all the time into and out of the airport, and that has slowed significantly to the point where when we hear an airline passenger plane flying overhead now, it's a surprise. So the re-engagement that we see is going to track with what we believe will be the likely re-engagement of the travel and tourism markets. And it won't be a V. Very famously, there was an economist's report done by the European Commission in 2006 that suggested a recovery from a pandemic would be a V-shaped recovery. And it won't be a U-shaped. An economist scenarios for with various scenarios for, I'm having trouble, let's see if this brings it back on board. Okay, with various scenarios as to when the constraint on travel is lifted. And notice that these are absolutes. There's one in July, there's one in September, there's one in December. It's not likely to be any one of those, but a set of these. So we expect the recovery won't be a smooth line, but rather a jagged set of on again, off again, foot on the accelerator, foot on the brake kind of recovery. Now, this gets us back to the point I tried to make at the beginning about healthcare capacity. There are significant numbers of deaths reported from COVID-19, and virtually entire national healthcare systems have been rededicated to the care of persons with COVID-19. And in certain locations, such as Italy, where the acute hospitalized cases have started to decline or to subside, the non-urgent capacity is growing. In the private system, in many countries where the public systems were devoted or dedicated to COVID, the private systems have been achingly lacking in fulfillment. The supply is available and ready to be utilized. What we need is lessening of the travel restrictions. So the available capacity is going to be critical. The available perceived safe capacity will be even more critical, and that will get us into the brands of certain destinations and the way comparatively that consumers may look at certain destinations and certain providers during the recovery period. Here is a heat map of deaths in Europe relative from the 5th of May. And this situation, like since we were talking about gin earlier, I was reminded of champagne. This map, in this map, bubbles, smaller bubbles are better, like champagne. And in certain locations where the bubbles are very small, the number of deaths is also very small. How will the publicity associated with deaths, with hospitalizations, how will the publicity that's tied to a particular location, how will this affect the willingness of consumers in other locations to seek care or to seek services in those locations? That remains to be seen and will be a very important component of the emergence of the health tourism markets. And one of the things we're very much going to need, we're going to need better segmentation. Laszlo referred to this earlier, not just demographic segmentation, but careful psychographic segmentation that looks at what the motivations are associated with consumers' willingness or unwillingness to travel, and how those factors play in with each other. One of the things that's very clear to me, this situation was the case pre-COVID, and I believe it will endure post-COVID as well, is that just as the market arrays from low acuity to high acuity, and with low acuity being high volume, low unit value, and high acuity being low volume, high value, in the relationship between and among providers and destinations, the same sort of relationship occurs. Specifically, as I was referencing earlier, the destination of Rochester, Minnesota is significantly less important than the destination Mayo Clinic. Similarly, the Cleveland Clinic, it's a coincidence that it's named after its location, but if people are looking for Cleveland Clinic level quaternary or tertiary services, the destination of Cleveland itself is less important to their concerns. Similarly with cancer treatments, MD Anderson, Dana-Farber, the destination itself is less important than the ability of that particular provider to meet the specific needs, oftentimes life-saving needs of that consumer. Whereas on the other end of this scale, where the acuity is low and the destination importance is probably high, I do care if my lava treatments are done in a safe and interesting location. And that relationship will continue to be important, and we'll need to continue to sort it out as we enter the post-COVID period and evaluate consumers' motivations, and inhibitions. So the recovery is an interesting and complex situation. We'll continue to cover it. We'll continue to address it. And as Romilly said at the outset, we'll be having another session in June covering the same things. The linear assumptions that more is better are likely to fall by the wayside. I believe many destinations will reevaluate this historical linear model. We can have more profitable medical and health tourism with fewer, more carefully selected tourists. And as we've been attempting to say, segmenting will be the key to this recovery scenario. Here in this display showing the relationship between acuity and frequency, we see the segments for high acuity, basically selfish, self-image, and even hedonistic related services. We see the demand for that coming back very quickly, as well as the pent-up demand for exigent, urgent, high acuity services also coming back very early. So we can look for that and deal with our communications and frankly our consumer management, our lead management in this way. The engagement or re-engagement of the health tourism markets we see will be tentative. Consumers will travel locally before they travel outside of their region. They'll go across the region before they go across the country, and certainly across the country before they go across borders. And as one of my colleagues reminded me, for countries like Germany, it's going to be a very good summer. So there'll be a tentative attitude by the consumer toward traveling and toward traveling outside of their region, even if regional restrictions are lifted. So we'll be dealing for some time with this concept of risk and risk abatement and providing consumers with confidence that where they are going is safe. Historically, safety has been what's referred to as a must-be quality of marketing services. And we never really used to refer to safety outright. We would show symbols of safety. So maybe what we're looking for now is a series of symbols to show that a certain destination or a certain provider is safe and observing the strictest hygiene, disinfection, and interpersonal behavioral procedures. I know that certain accrediting agencies like TIMOS and others are working on certificates. I know that Portugal, here where I live now, is also working on a safe destination certificate, some icons that can be applied to show consumers and give consumers that additional confidence. So fear and risk tolerance will be very interesting to follow in the days ahead. So that's how I'd like to stop here and see what sort of questions we have. I want to thank those who are participating and leave plenty of time for questions. Oh, I'm supposed to do something here. Sharing. There you go, Romilly.
Thank you for all attending today's webinar. We hope you found it informative. Now we're going to open the Q&A session. So the first question is, what should the healthcare providers which focus on international patients do until the new normal arrives?
Laszlo, you want to take that or shall I take it?
Well, that very much depends on the destination. I should think when you talk about countries or talk about cities, talk about areas, regions, that's I think very region or product specific. I cannot somehow believe that we have a general rule here, especially that every destination will be impacted by access of what governments are going to do in terms of or airlines and airports and border authorities will do to check, limit, control, supervise traveling of people. So you can do all sort of messages, whatever you wanted, anyone. But the question is, it's often not. Often it really doesn't depend on you, because you will be a victim of any kind of organizational, structural, regulation or activity. I think what we will see, and I would like to just mention briefly that we are just about finishing an industry depth interviews series looking at how wellness tourism will look like in the next 5-10 years. So by June, we will have the results of that. So anybody interested, that can be taken forward, and we can talk about that later. The destinations would need to find their very own ways. We never ever had any such thing in the history of tourism, that literally anything and everything is closed. So you don't have benchmarks, you don't have best practices, you don't have something to copy, you don't have anything, because everybody's exactly at the same place, which is nothing is happening right now. I mean, most of the places. So everybody would like, as soon as there will be some coordinated opening up, destinations will be desperately bombarding guests with various messages. I don't know how many aerial videos you have seen or participants of empty cities of London, New York, Paris, whichever it is. Every city wanted to show that we are empty and we're waiting for you. But it's not a value proposition that I'm waiting for you. That's more like a wish. And this is, again, not just segmentation, but also what exactly you are. When airlines cannot give you cheap tickets and you cannot count on cheap flyers, then you have to really find those people who really want to see you, not just one place which is relatively cheap, but a place which offers something which is relevant to me. So that's why you need to define yourself, probably, or redefine yourself. And this is when it becomes, complicated, because there's so many players in the business, and everybody will be desperate to have guests at any cost, the shortest time possible, because of the cash flow problems and the finance situation. So that's, as Irving said earlier, that will be a very challenging position to be in, to talk to guests who are really our guests, not just some guests who may turn up at our place.
For providers, I completely agree with you, Laszlo. And for providers in particular, it's really up to you now to put your messages forward, share insights, clinical, behavioral insights with your target audiences. To, if you're a wellness provider, show wellness tips for being in isolation. If you're a hospital, provide authoritative clinical information about particular procedures. And what providers can do is, Laszlo was addressing destinations, but what providers can do is access the new telehealth telemetry tools to start to fill up your pipelines now, to engage consumers who are suddenly completely oriented to using Zoom, using Skype, using WhatsApp, the various video tools, to reach out to the audiences whom you can't host, but with whom you can have a conversation about when it's safe, when you're ready, what do I need, how do I get it, how will I access it, and remain very open to how you manage those processes. So the first bit of coaching, and this goes back to the crisis communications webinar that we gave a few weeks ago. You can access this on our website. The first thing is, you've got to say something. The providers cannot afford to be silent during this time, either passively or actively. The second principle is, use this time to fill up your pipelines with interested, motivated consumers who, when the time comes, will be willing to engage you as a provider of services.
Thank you. The next question. What psychographic characteristics should we look for from wellness, health, and medical travelers?
I think they're really different.
That's a $1 million question. That's wonderful.
Yeah. I think if I may take the first part of this one.
There you go.
I think the model that Stackpole Associates has used historically is called the PRISM Psychographic Segmenting model, and that breaks down into risk aversion and risk acceptance. That's one of the dimensions. And for the earliest, for the class of individuals who are earliest willing to assume the risks associated with traveling to consume services, you don't want the people who are belts and braces. You want the people who really are quite adventurous, people who are willing to take a risk, people who are willing to go through the airports with masks on, get things stuck in their ears to take their temperatures and all that stuff. The gauntlet of challenges that consumers will need to go through to travel will change. Those are the consumers especially for medical services, whom we need to locate. And that can be done through good segmenting tools. On the wellness side, I don't know, Laszlo, I don't think the profile would be much different. What are your thoughts?
Not necessarily different. I would refer to lifestyle-based segmentation, when age may not be relevant, when jobs will not be necessarily relevant, where you live will not necessarily be relevant, but more relevant is how you look at life, how you look at the world, which tribe you want to belong to. And I would like to refer to one of the terminologies that came up recently, when you combine seniors and teenagers and they become teenagers. So just because you technically belong to a senior age group, it doesn't mean that you cannot find activities which typically teenagers find attractive right now, attractive yourself as well. And that calls attention to how look at consumer data. You may look at fashion data, you might look at leisure activities data, you might look at all sort of data sources, and then you amalgam something which is relevant to you. And this is a very different way of looking at data or consumer data and how people spend the money. And don't forget, the spending on a voluntary activity or an elective activity like going to a wellness trip, whatever kind that is, or looking for wellness services, that may compete with not another trip or not with a medical trip, but also with, actually, I'm not spending any money, I'm saving because I'm worried. Or they have barriers. What are those barriers that would keep people away from even thinking about traveling? And as soon as you understand those triggers which keep people or can initiate people, then you will be on a good track.
Yes, couldn't agree more.
Thank you. Next question. With respect to COVID-19, what techniques and/or treatments might impact better health outcomes for some destinations or countries compared to others?
Well, then we received another $1 million question. Thank you. Yeah. That's and if I understood well, the question refers to what are the services that remain popular or we can become popular compared to others? I think
might impact.
Yes, I think anything that doesn't have evidence, anything that doesn't have not just a story, but something which is documented in a background information and relevance, people will be very suspicious about. We have a lot of mumbo jumbo. We have some amazingly photographed and videographed services without any context or without any core message whatsoever, just they look good, just like Instagram, without any kind of content there. And I believe people will prefer destinations and services where they can find all those references, evidences, tests, clinical trials, if it's medical, if it's wellness evidence, if it's wellness, which can assure them this is not just a mockery, this is not just something for show, but there is some evidence behind it, and it's being tested not just against COVID-19, but against any kind of benefit, not just value, but also benefit.
I couldn't agree more, and I think that the evidence is clear that many more consumers are now spending far more time on the internet, and one can only assume that some significant part of that time is evaluating various treatments, procedures, providers, destinations, and I expect that that behavior will carry forward in the new normal, whatever that looks like, that whatever research had been previously done by prospective health travelers to look at the destination and the provider, there'll be even more of that going forward.
Can I add one more thing, Romilly, just one note? I believe we have audience here with from lots of different countries where you have a lot of evidence, but maybe available only in your own language.
Right.
And that will be a major barrier, because maybe domestically you can promote that service and people will find it relevant, but internationally, service providers, insurance companies will look evidence and facts in a language and in a style that they can understand and they find relevant. So revisiting of what you have and introducing it in another language and in a different style will be absolutely essential.
Thank you. Next question. Which demographic should small island states in, say, the Caribbean be focusing on their marketing efforts first to promote their health and wellness attributes?
Sorry,
I repeat.
Sorry,
Which demographic should small island states in, say, the Caribbean be focusing on first in their marketing efforts to promote their health and wellness attributes?
My instant reaction was something which is, say, I want to give you something which is kind of elevating the mood and not just being stupid. A demographic that who can swim well, because you will need to provide opportunities to get to you, and that will be the absolutely critical. Cruises, flights, this is exactly the transport options which are limited right now, and that will be essential here. And unfortunately, especially small islands, probably that will be the last on the list of any major airline and even charter airlines to open up because of the financial issues and the frequency issues. However, especially Caribbean islands, as we know, Gulfstream and all those business jets just putting on the market larger private jets, and especially those markets will open up, I think, very quickly, the very high end, when you can cater for parties of 20 people, 15 people, or 30 people who can fly in a small exclusive jet to your destination from a major source city through a private boarding channel. That will be probably something that can pick up very, very quickly.
I agree with the concept that the people with money will figure out a way to get there. There's no doubt about that, and that the side of the market that will re-engage first, I believe, will be the volume, low unit value side of the market, which lends itself to the wellness and health attributes of the Caribbean. And Laszlo was absolutely correct that the constriction point in re-entry, re-engagement, will be physical access. So how that physical access opens up. The literal answer to the question is go for the demographic with the money, the employed 41 to 64-year-old person with the disposable assets, who can't afford the private jet. It takes on a luxury. What was your combination of words, your conflation of words, Laszlo? Is luxury necessity? It takes on a necessity luxury kind of a necessary luxury. Yes.
And one more segment, and especially thinking about the Caribbean islands. I know the gig economy, SSGIG, is something that is being questioned or discussed heavily, even before the COVID, since it also includes employees who are temporarily employed only just for 3 months, and they can be released very quickly. So that's the it provides them no security of a job, but also refers to not just the ones that Irving mentioned, who are employed and they have a safe job, but also who are like bees flying from one project to another, and they may cash in a lot of money from one, and they have no time because the next project will come only in 6 months' time, but they will have the intention, the money, and the interest because they are the citizens of the world, and they belong to the, what is it, 17% of the US economy is now employed in a gig economy, and they might actually have the money and the intention, and they're not solo travelers, some of them are, but also they have families and they bring the kids as well. And that's a totally different demographics, and it is a totally different way of looking at travel, because they don't book 6 months ahead, they decide about next week. And they may come for 2 months because they said, you know what, you have Wi-Fi and I'm perfectly fine of doing my business from Curacao, whichever I'm selling in whichever country, and absolutely enjoy that no other people around, which is not good for the destination, but it's fantastic for me.
Good.
Thank you. Okay, a couple more. With the NHS in the UK estimating to come out of this crisis with even bigger waiting lists for elective care, in combination with the poor management of the crisis by the UK government, would you perhaps find more UK customers being more confident to travel abroad to a more safe destination to have their elective care?
So I would answer that by first modifying the question. I believe that certain UK residents will certainly now feel more secure, feel more confident, be motivated to look at alternative destinations for their care. And there are two things at work here. One is the potential damage that certain locations, certain countries, healthcare systems underwent. The brand of not NHS inside of the UK, but the brand of the NHS as a safe and secure place to go to consume services, that brand may be damaged going forward. The reputation may be damaged. Consumers inside the UK will now look up and look around, and I showed that map earlier of the European locations where the death rate was significantly higher, and others where the death rates were significantly lower. The comparative competitive position of destination countries, I believe, can become part of an advantage or disadvantage for providers located in those destinations, or destinations that want to build and establish themselves as attractive medical travel destinations. So yes, I believe that there will be a shift in the way UK consumers look at opportunities outside of their country, but I think it's not just the UK. I believe that these motivations will be similarly altered and shifted across Europe and in other locations in the world as well.
And just one little note here, Irving, if you let me. The public healthcare, private healthcare dilemma, since the COVID at the moment is really stretching the public healthcare service providers all across the world. And this is when a certain country not managing it as well as the consumers might have expected, regardless of it is factual or it isn't, since they are not healthcare professionals, they just only consumers in that sense, they might opt for private service providers somewhere else. Either in the UK, which is an option too, but also outside of the UK, because you say that, God, I don't want to go through something like someone I know in NHS, because it was horrific, all the images I've seen, all the hospitals in Spain, public hospitals, but I will opt for private services. And you might say that even younger generations, that this is the moment when I need to decide of saving money for private healthcare. I need to take care of myself, because I'm a little bit worried that public healthcare may not be up to such challenges, and that may actually increase spending on private healthcare. This is obviously is just an assumption at the moment, but in a couple of months' time, we will probably see in a more secure way how this will go.
Thank you. Next question. Do you think that domestic medical tourism will come back first and then abroad? And then will this apply to its neighboring countries?
Yes, very simply, yes. People will. There was a recent survey done in the US and the UK that I looked at, and it was quite robust. And the place consumers feel safest is in their cars. So it only makes sense that they're going to use their cars to get to where they can receive the services, whether they're on the hedonistic scale or the medically exigent side of the scale. They're going to use their automobiles to get where they can consume those services, where they can acquire those services, which changes the look at the mapping and the procedures for looking at where you attract your consumers from, changes quite a bit. And this is an important message for both providers and destinations at this time.
And when you are competing with domestic travelers, domestic service providers, clinics, hospitals, physicians, you can provide an alternative and compelling proposition, as long as you can say what your success rates are of a certain treatment, or how low your infection rates are. Don't forget, in countries, and Irving knows that really, very well, even way better than I do, that countries don't necessarily share this critical information in the same fashion, especially public healthcare providers, in one country as another country. And if you, as a private healthcare provider, can show with actual and reliable data that your success rates, infection control rates, and all those critical measures, KPIs if you wish, are really so great, then you can lure international patients as well. But you really have to up your game, and you have to be able to show facts of why your treatments, why your protocols are competitive.
Excellent, thank you. The final question for today is would destination countries accept patients from abroad? And is this only in private providers, as the public systems are going to be broke?
Well, as far as I know, there are the number of consumers moving across international borders to consume care. If it's occurring anywhere, it's a trickle. So I don't know that this is occurring at all. I believe the markets have frozen. The travel has ceased. Travel is beginning to open up in Europe, and if the person asking the question was asking where we think it will open up first, it will open up first between those countries that have managed the pandemic most effectively. So it will open up fastest there. It will open up quickly where political will, despite the epidemiological facts, where political will says, I'm going to open up. I don't think that's going to inspire confidence among the consumers, but the markets will open up. And we have to watch. We have to watch and see how travel resumes. There are available sources to go to for travel and tourism data that are updated regularly, and we can watch how these markets begin to return. But we don't expect a swift, a V-shape or even a U-shape return. It's going to be far more gradual, halting, and incremental. Laszlo?
Yes, if you have just add just one line here, really. It is going to be the test of how well your personal brand or protocol brand is being built. If you can prove that I am the physician who with 15, 20, I don't know how many years of experience, I have been doing this treatment and protocol successfully over 3,000 patients, and I repeat the same, and it's happening, and you have the results, and you are speaking in this country, that country, you have patents, and all the rest of it, people will travel. That's because they want you, they want your knowledge, your experience, and they want to have the best of the best in a moment like this. The same as with in the wellness part, as long as you can prove this relevance and you can prove the background information, and you really have to have personal brands. You have to have, when we talk about destination development in, let's say, health tourism, we always look at, we call it as the enigma of the 9 or 12 critical points. Which of those points that you really excelled do you have that apart from price or availability? Because it will not be enough. People will not find it for the moment, especially short term, a good enough reason that you actually have some services. This is when you have to have technology, top-notch technology, top-notch surgeons, the best protocols of latest protocols that you have, which are safe as well as providing results. I think the safe environment of, oh, well, I'm competing in prices probably over for a while. I don't know, Irving, what you think about that. But that's you really have to up your game, and this is when, you know, destination development and branding really comes in, something that's we all need to work on.
Well said.
So, thank you all for attending today's webinar. We hope you found it informative. Please look out for an email with a link to the recording as well as a brief survey. Thank you in advance for all taking part, and just take a few minutes for your feedback. Once again, we will host another webinar, Health Tourism After COVID-19, The Road Ahead Updated, on June the 3rd at the same time as today's session. Have a wonderful day or evening, wherever you are in the world. Thank you.
Thank you.